Report. I'm Scott Pelley. We're about to hear from the Speaker of the House, Paul Ryan, about his decision just minutes ago to pull the Republican health care bill, the replacement for Obamacare, as opposed to having a vote and seeing the bill go down to defeat. A vote on the bill, first scheduled for yesterday, was pulled today because President Trump could not muster enough Republican votes in the Republican-controlled House to get it through. But by this afternoon, it was clear the votes were still not there. Speaker Ryan canceled the vote, pulled the bill to avoid an embarrassing defeat. As we watch the Speaker's podium now live, let's go to Margaret Brennan as we're awaiting Paul Ryan. Margaret is at the White House. Margaret, what is the president saying at this point?
Well, actually, Scott, we know what the president is saying because a lot of it's being live tweeted right now by some of the reporters that he's personally calling to explain this to at the Washington Post and at the New York Times. The president has actually been speaking to describe this decision to pull the bill and avoid the embarrassment that you talked about there. What he has said is that he does not personally blame Speaker Ryan for the inability to whip the votes needed to get that more conservative branch on board with this bill to get this Republican plan through. But he has also been saying that this is still something that he thinks, or at least he's describing, as very much all or nothing. It was this bill or face the failure of Obamacare, which he says is really impending and urgently needs addressing, or you will face the consequences, something that he believes is political leverage and has been describing as political leverage, he thought, to get some of those skeptics on board with this overhaul plan. That tactic didn't work, at least rhetorically. He's saying that that's still where he is, that this failure to follow through in supporting the Republican plan will mean standing by and allowing Obamacare to fail. Now, tactically, we'll have to see if that's how it plays out. When we hear from Speaker Ryan, we'll hear whether this will affect the rest of the president's agenda. Up until this point, the White House and Speaker Ryan have been insistent that Obamacare and addressing it, repealing, replacing it, has to happen before tax reform because the math for them didn't add up in terms of the kind of cost savings they thought they could justify with step one to move on to step two. We will see. Is that still the case? We don't know yet, but this is really an interesting thing to watch here when we hear from Speaker Ryan and when we hear later from President Trump, because he will be speaking to the press shortly.
Margaret Brennan at the White House for us. Now, of course, repealing Obamacare was the signature election issue for President Trump and for Republicans running for seats in the Congress and the Senate everywhere. And it is ironic, to say the least, that it was the Republicans who were unable to get this passed. Here now is the Speaker of the House, Paul Ryan.
You've all heard me say this before. Moving from an opposition party to a governing party comes with growing pains. And, well, we're feeling those growing pains today. We came really close today, but we came up short. I spoke to the president just a little while ago, and I told him that the best thing I think to do is to pull this bill, and he agreed with that decision. I will not sugarcoat this. This is a disappointing day for us. Doing big things is hard. All of us, myself included, we will need time to reflect on how we got to this moment, what we could have done to do it better. But ultimately, this all kind of comes down to a choice. Are all of us willing to give a little to get something done? Are we willing to say yes to the good, to the very good, even if it's not the perfect? Because if we're willing to do that, we still have such an incredible opportunity in front of us. There remains so much that we can do to help improve people's lives, and we will. Because I got to tell you, that's why I'm here. And I know it's why every member of this conference is here, to make this a better country. We want American families to feel more confident in their lot in life. We want the next generation to know that, yes, the best days of this country are still ahead of us. I'm really proud of the bill that we produced. It would make a dramatic improvement in our healthcare system and provide relief by people hurting under Obamacare. And what's probably most troubling is the worst is yet to come with Obamacare. I'm also proud of the long, inclusive, member-driven process that we had. Any member who wanted to engage constructively, to offer ideas, to improve this bill, they could. And I want to thank so many members who helped make this bill better. A lot of our members put a lot of hard work into this. I also want to thank the president. I want to thank the vice president. I want to thank Tom Price, Mick Mulvaney, and the entire White House team. The president gave his all in this effort. He did everything he possibly could to help people see the opportunity that we have with this bill. He's really been fantastic. Still, we got to do better, and we will. I absolutely believe that. This is a setback, no two ways about it. But it is not the end of the story, because I know that every man and woman in this conference is now motivated more than ever to step up our game, to deliver on our promises. I know that everyone is committed to seizing this incredible opportunity that we have, and I sure am.
One is, we talked about real people. Now you've got a law in the books, the Reform Act that you guys don't like, the White House doesn't like, but it's going to be the law for the foreseeable future. Do you plan to try to help it along and prop it up, or do you plan to just let it wither?
Yeah, this is the problem. I worry. The question is we kind of prop it along and try and prop it up. It is so fundamentally flawed, I don't know that that is possible. What we're really worried about is, and you've heard me say this all along, is the coming premium increases that are coming with a death spiraling healthcare system. That is my big concern. We just didn't quite get consensus today. What we have is a member-driven process to try and get consensus. We came very close, but we did not get that consensus. That's why I thought the wise thing to do is not proceed with a vote, but to pull the bill and see what we can do. But I don't think the law, as it is fashioned, or anything close to it, is really going to be able to survive.
Legislation now to try to
we'll see. We're going to go back and figure out what the next steps are. Yeah.
Can you explain if it is the conservatives of the Freedom Caucus who effectively drove out your predecessor, John Boehner? Are they responsible for the defeat here today?
Well, I don't want to cast blame. There is a block of no votes that we had that is why this didn't pass. They were a sufficient number of votes that prevented it from passing, and they didn't change their votes. We were close. Some of the members of that caucus were voting with us, but not enough were, and therefore, and I met with their chairman earlier today, and he made it clear to me that the votes weren't going to be there from their team, and that was sufficient to provide the votes, the balance to not have this bill pass.
You all swept the House, won the majority with a promise to repeal Obamacare. Majority in the Senate with a promise to repeal Obamacare. The White House with the promise to repeal Obamacare. How do you go home to your constituents and send all of your members home to their constituents saying, you know what, it's not even 100 days into the administration. Sorry, folks, we just can't figure it out.
Dana, it's a really good question. I wish I had a better answer for you. I really believe that Obamacare is a law that is collapsing. It's hurting families. It's not working. It was designed in a fundamentally flawed way. We believe this bill is the best way to go, but we just didn't quite get the consensus to get there.
Mr. Speaker.
Two questions for you, if you don't mind. One, the bottom line is Obamacare right now remains the law of the land. Is that going to change in 2017?
Yeah, I don't know what else to say other than Obamacare is the law of the land. It's going to remain the law of the land until it's replaced. We did not have quite the votes to replace this law. And so, yeah, we're going to be living with Obamacare for the foreseeable future. I don't know how long it's going to take us to replace this law. My worry is Obamacare is going to be getting even worse. Actually, I think we were probably doing the Democrats a favor. I think we were doing the architects of Obama a favor by passing this law before it gets even worse. Well, I guess that favor is not going to be given to them, and it's going to get worse. And so I don't think the architects of Obamacare, I'm sure they may be pleased right now, but when they see how bad this thing gets, based on all the projections we're being told by the plans that are participating in Obamacare, I don't think they're going to like that either. Look, 5 states, you got one plan left, one choice. Over a third of the counties in America, one plan left. And the kinds of projections we're being told from the people providing health insurance to these people in plans, it's going to get even worse. And so I don't think the architects of Obamacare envision this future. It's certainly not one we want for the American people. And I wish we had the kind of consensus we needed to bring a bill to the floor to pass and replace it. But we just don't have that right now.
Speaker.
Chad. Chad.
What about the political capital that was burned here? You have to keep the government open in about 5 weeks. The debt ceiling, you still want to do tax reform. I know you say that this part was integral to getting to that part. How much capital did you burn on this debate, and how does that potentially injure those other bills?
I think our members know we did everything we could to get consensus. This is how governing works when you're in the majority. We need to get 216 people to agree with each other to write legislation. Not 210, not 215. We need 216 people in the House to agree with each other on how to write a piece of legislation. We didn't have 216 people. We were close, but we did not have 216 people. And that's how legislating works. And so now we're going to move on with the rest of our agenda because we have big, ambitious plans to improve people's lives in this country. We want to secure the border. We want to rebuild our military. We want to get the deficit under control. We want infrastructure, and we want tax reform. The last question you asked me about tax reform, Chad, yes, this does make tax reform more difficult, but it does not in any way make it impossible. We will proceed with tax reform. We will continue with tax reform. That's an issue I know quite a bit about. I used to run that committee. I spoke with the President, the Treasury Secretary, and his economic advisors earlier today about tax reform. So we are going to proceed with tax reform. This makes it clearly more difficult. You know how the numbers work. It's about $1 trillion. But that just means the Obamacare taxes stay with Obamacare. We're going to go fix the rest of the tax code. I don't think so. I don't think this is prologue for other future things because members realize there are other parts of our agenda that people have even more agreement on what to achieve. We have even more agreement on the need and the nature of tax reform, on funding the government, on rebuilding the military, on securing the border. This issue had a big difference of opinion, not whether we should repeal and replace Obamacare, but just how we should replace it. And that is the growing pains of governing. We were a 10-year opposition party where being against things was easy to do. You just had to be against it. And now, in 3 months' time, we try to go to a governing party where we actually have to get 216 people to agree with each other on how we do things. And we weren't just quite there today. We will get there, but we weren't there today.
Yeah. Hi, Anna Edgerton from Bloomberg. I was wondering if you're going to move ahead with Phase 2 and 3, HHS Phase 2 and here with Phase 3 legislation. And also, if you can just talk about how the conference is feeling right now.
The conference is let down. The conference is disappointed. The conference, we were on the cusp of fulfilling a promise that we made. We were on the cusp of achieving an ambition that we've all had for 7 years, and we came a little short. We were close, but not quite there. On your other issues, this bill would have made what we call Phase 2 much, much better. Nevertheless, I think there are some things that the Secretary of HHS can do to try and sort of stabilize things, but really we needed this bill to make it better. For instance, risk pools. We believe the smarter way to help people with pre-existing conditions get affordable coverage while bringing down the health care costs for everybody else is through reinsurance risk or risk-sharing pools, which this bill supplied for the states. That's not now going to happen, and therefore he won't be able to deploy that policy tool that we think is better than Obamacare. So we do lose a lot of the tools we wanted to help improve people's lives and bring down health care costs in this country. Thank you very much, everybody. Appreciate it.
Speaker of the House Paul Ryan live at the Capitol. Ryan explaining why it was he pulled the Obamacare repeal and replacement bill. He simply did not have enough votes to pass it. It is a major defeat for Speaker Ryan and President Trump, who had put all of their political capital in this one bill and had been lobbying for it for many days now. Last night, President Trump said that Republicans would either have to pass the bill today or live with Obamacare as the president moved on to other priorities. It's still a bit of a shambles now. We don't know what they are going to try to do next. Now, the Republicans had the votes to pass this bill without any help from the Democrats. It was the Republicans that scuttled their own bill. The most conservative Republicans felt like the bill did not do enough to tear Obamacare out by the roots, while moderate Republicans felt that the bill went too far in cutting benefits for the poor and for the elderly. John Dickerson is our political director and, of course, the anchor of Face the Nation. John, it took President Kennedy and President Johnson 3 years to pass the Civil Rights Act of 1964. What was the hurry? They were trying to do this in only 9 weeks.
Well, the hurry was that they believe that this is a promise they had to keep from the 8 years of attacking Obamacare and saying that this was what Republicans wanted to do. And presidents have learned that you got to move fast, really, if you want to take on something big. They always knew, though, that there was a risk in doing this because, as President Trump later said, dealing with health care is a complicated thing. So they wanted to move quickly also because they've got other big agenda items they want to try and get to before the 2018 election encroaches on what they're doing. And that's a long way off, except in political time, when it really does start to encroach on the thinking of various members. The thing to watch, I think, for the next couple of days is how unified Paul Ryan, the Speaker of the House, and President Donald Trump are. President Trump has been telling reporters that he doesn't blame the Speaker of the House. Paul Ryan said the White House did everything they could. The president did everything he could. But in news reports today, there's been a lot of anonymous sources taking shots at Paul Ryan on the president's behalf. And that's a problem for two reasons. One, it really hurts any future attempts to get anything done with health care. But also, the rest of the things the president wants to do through Congress, those will be complicated, too. Those will require the same kinds of trade-offs. And so the two need to be unified if they're going to get anything done. And finally, I'd say Paul Ryan suggested there was only Republican alternatives to the failed bill today. There is another route, which is to reach out to Democrats and possibly work with them, but that doesn't seem on the table at the moment.
Apparently, on that point, John, the president told a reporter today, when Obamacare explodes, the Democrats will come to us. That apparently is the fallback plan that the president has in mind, at least at this moment. There will be much more about this on your local news, on this CBS station, on our 24-hour streaming news service, CBSN, and right here tonight on the CBS Evening News. Until then, I'm Scott Pelley, CBS News in New York.